Good afternoon. I am Dr. Ponu Shankara Pillai, Specialist Neurologist at Aster Hospital, Mankul, Dubai. So today I am going to talk about Bell's palsy. So what is Bell's palsy? So Bell's palsy is the temporary paralysis of one side of the face due to inflammation of the facial nerve. So facial nerve is the seventh nerve of the head and neck that controls the movement of the face, or it controls the muscles of the face. So what are the symptoms of Bell's palsy? Somebody with Bell's palsy will have drooping of one side of the face, or drooping of the angle of the mouth, or deviation of the angle of the mouth, difficulty to close one side of the eyes on the affected side, difficulty to raise the eyebrows on the affected side, and when they try to eat or drink, there will be leakage of food particles of water from the side of the mouth on the affected side. Some people can also have changes in the taste and tear formation on the eyes, etc. Now, what are the causes of Bell's palsy? So, Bell's palsy is typically described as idiopathic facial palsy. Idiopathic means no apparent reason, but changes in the climate or cold season, viral infection, all these can trigger a facial paralysis or Bell's palsy. The facial nerve starts from the back of the brain from a structure called the brainstem, and it travels through the ear canal and then reaches the face and supplies the face muscles. So any lesion along this pathway can produce facial paralysis. Sometimes a stroke in the brainstem or at a region called pons can produce facial paralysis, or ear infection can cause facial paralysis because the facial nerve passes through the ear canal. All these are not called Bell's palsy. They're called facial paralysis secondary to that reason, secondary to a stroke or secondary to an ear infection. So how do we diagnose Bell's palsy? So the diagnosis is mainly from history or clinical examination. If there's any other symptoms suggestive of stroke, such as maybe a weakness of the hand and legs, or numbness of hand and legs, or some other symptoms or sign, then we always subject the patient to an MRI of the brain. If somebody has ear discharge or ear ache, again it could be secondary to ear infection. So it's very important to take a brief history and a detailed clinical examination to rule out other causes such as stroke, ear infection, and other lesions of the facial nerve. In an elderly, especially with comorbidities such as BP or sugar or cholesterol, if they come with Bell's palsy or probable Bell's palsy, it's better to subject them to an imaging to rule out stroke because of the age and the other comorbidities. So how do we treat Bell's palsy? So Bell's palsy is a condition that has very effective treatment. It almost completely resolves within a span of 2 to 3 months. And the treatment strategy includes oral tablets of steroid tablets with physiotherapy, electrical stimulation. All these are the measures that we use to reverse the facial paralysis, and the patients usually get almost 100% improvement in the symptoms. Facial paralysis is almost resolved within a span of 2 to 3 months. In some patients, after a few months or years after recovery from the facial paralysis, they can have something called a hemifacial spasm, whereby one side of the face starts twitching involuntarily, like this. So this is called hemifacial spasm. This is a complication of facial paralysis, and this also has effective treatment strategies. This is in short about Bell's palsy. I hope this was helpful.